my name is Chelsea and this is my Assessment 1 for Leadership for Beginning Practice on Violence and Aggression in Mental Health Nursing. The prevalence of mental health in Australia is currently on the rise, with approximately 20.1% of the population currently suffering from a mental health condition. That is an increase of 2.6% from 2014-15. Research suggests that a majority of violence that occurs in hospitals is caused by a mental health disorder. According to Owen 1998, nurses are the most common target for workplace violence and aggression, which is just unacceptable. It has been said that almost 1 in 5 psychiatric admissions may commit an act of violence. This is a major problem in our hospitals today, as it is a risk of major injury to not only staff, but to other patients and to the offender. Throughout this presentation, I aim to engage the visual learners through images and different slide layouts. There are also online modules available on this topic for these people. For the auditory learners, I am able to engage you through talking through this topic and presentation, and I also encourage you to talk to your peers and colleagues after this presentation about any ideas you may have about this topic. And for the kinesthetic learners, you are able to take notes on this presentation, and there are also face-to-face seminars and workshops you are able to attend. In this presentation, I hope to demonstrate leadership by inspiring you to conduct further research on this topic and to see what techniques you could learn about de-escalation and how to appropriately handle aggressive and violent behaviours. I hope to encourage you all to research your local health district's policies and procedures on handling aggressive behaviours after this presentation, and to come up with a few training ideas for your workplace to better improve your skills and knowledge, to be able to improve the safety of the patients and make your workplace as healthy as it can be. Aggression in the hospitals is a contemporary issue due to the fact that there is an increase in the number of people who have a mental health issue, which causes an increase in the possibility of aggressive situations. It is said that approximately 45% of aggressive and violent situations end in harm, which does not represent a healthy workplace. This is a major issue in our hospitals and clinics today, as this leads to an increase in nurse sick leave, high staff turnover, and the increased use of temporary staff, which links to a lower standard of care. The amount of abuse that nurses get from violent and aggressive patients while working has become so prevalent that it is now seen as just part of the job, which is having major effects on the nurse's health. Because of this abuse we receive on a regular basis, one survey showed that 63.3% of the nurses were considering leaving the hospital in which they worked, and 8.8% of the nurses considered leaving the nursing profession. Currently, in specific wards, such as mental health wards, it is compulsory for all staff to wear personal duress alarms, which notifies security to provide help in violent and aggressive situations. The use of the personal duress alarms allows for a safer work environment, as nurses will have quick access to security notification and assistance. It is important that as a new graduate nurse, we are orientated to the workplace properly, and we are aware of how to use personal duress alarms and are wearing them at all times. All staff should be checking the alarms at the beginning of each shift to ensure that they work properly and are reporting any damages or faults to the managers. In response to a personal duress alarm activation, a code black will be issued. This will result in the code black team, who are specifically trained to respond to these emergencies, to respond quickly to the area of the situation. These people vary depending on the location and institution you are working in. They can range from a specifically trained healthcare workers, security staff, and police. After the incident has de-escalated and resolved, it must be reported using your local health district's policies, such as an IMS. The incident also needs to be reported in the patient's clinical records to allow for all health staff that will be caring for this person to be aware of their behaviour. This will allow staff to know to exercise extra caution when interacting with them. Additional documentation that must be completed is a behavioural management plan, which must be continuously reviewed, monitored, and updated by the caring nurse to ensure a safe workplace. These measures allowed for a healthcare staff to know about potentially dangerous patients to ensure a healthy workplace for all staff. Physical and manual restraint should be a last resort when dealing with aggression, as it increases the risk of physical and psychological harm to staff and the consumers. Physical restraint increases the risk of physical harm to staff and the consumer, and therefore should only be undertaken by trained staff. There are currently online modules on how to de-escalate aggressive behaviours on sites such as Health Education and Training, as well as postgraduate courses that registered nurses can do which specialise in mental health nursing. This provides tools and techniques on how to manage patients with mental health problems. Having staff take initiative and leadership in taking these courses increases the health and safety of the workplace, which also increases the safety of patients, as staff are appropriately trained in de-escalating situations before harm occurs. This increase in knowledge and confidence in de-escalation techniques follows through with a reduced number of sick days taken by mental health nurses and a lower instance of harm towards nursing staff, which all leads to a healthier workplace. There has been research to suggest that there are characteristics that are predictors for violent and aggressive behaviours. Those who are agitated, suspicious, and unwilling to follow direction are more likely to become aggressive. It is important for nurses to be able to pick up these characteristics so that they are able to use the knowledge and skills they have to try and calm these patients down to avoid any unwanted behaviours. Staff on mental health wards should also be frequently conducting information sessions and in-services to ensure that the information and techniques stay up to date and fresh in their mind. As a new graduate nurse, it is crucial that I am following all New South Wales health guidelines and policies and procedures relevant to my local health district and workplace. This will ensure optimum care that is given to every patient that I am caring for. Reflection and discussion within your team should also occur regularly and also after any violent or aggressive behaviour to be able to expand and change our knowledge to make any improvements in the way we handle these situations. Being able to openly reflect allows the nurses working together to explore new ways of caring and to expand their knowledge of techniques, all while working together to make their team stronger, which will enhance a healthy workplace. As previously stated, it is a requirement for all staff to report all violent and aggressive behaviours to ensure the safety of all healthcare workers. It is in all registered nurses' scope of practice to remain up to date with policies and procedures in their local health district. All New South Wales health organisations must have a violence prevention program which maintains the aim of eliminating violence in the workplace. De-escalation techniques should be part of all violence reducing training. All staff must be in consult about violence risk reduction and all be aware of proper strategies in place to reduce and eliminate the risk of violence. All nurses working in mental health wards or clinics must adhere to the New South Wales Health Mental Act 2007. Allowing consumers to participate in their care and allowing them to have the knowledge about what is happening in their care makes them feel as though they have control over their situation and can lead to a reduced amount of potential violence. In conclusion, violence and aggression is becoming a major problem for nurses in mental health wards. It has been shown that an increase in the amount of training mental health nurses receive reduces the amount of escalated violence and aggression as staff are more educated and confident in performing de-escalating techniques. This reduction in the amount of violence towards nurses improves the quality of care being given and brings about a healthier workplace. With nurses being happier and a closer team in the workplace, the patients will be able to receive optimum care improving patient safety in the workplace. I have attached here all my references that I have used throughout this PowerPoint. Thank you for listening.